Good afternoon, everybody. Thanks so much for joining this week's office hours here at Infinix. This week, we've got the pleasure of having our chairman, Jaideep Tandon, here with us. And today, as you saw in the email and the notifications, that we're going to explore a topic that is keeping a lot of healthcare providers up at night, and that is staffing challenges. So we want this to be interactive. So if you've got questions, feel free to pop them in the Q&A chat, and we will certainly get into those as we go along. So Jaideep, I was hoping that you could kick us off and just give us an overview of what's happening right now in the current healthcare staffing climate.
Yeah. Well, Kate, thanks for setting this up and inviting me. I love doing this, don't get enough opportunities, so I'm glad you finally asked me. So yeah, I mean, I think the topic here around healthcare staffing, absolutely very current and very critical to a lot in the industry. And in sort of the way I look at it is really to understand this, we've got to go back a couple of years where strains were starting to be seen in overall healthcare industry. Work fatigue was kicking in across the board. However, healthcare industry kept moving along. And then about a year and a half ago, when COVID hit, it's just like a freight train getting derailed, right? I mean, there's been suddenly overnight, the system had to redesign itself to say, we've got this pandemic that we have to take care of, and nothing else matters. We've got to figure out how we regroup, take care of employee safety, meet patient needs, at the same time, recognizing that a lot of outpatient elective surgeries, where money comes into the system may not be coming in for some time. So how do you stay financially viable, yet at the same time, be able to meet the needs of the community? And as that goes along, lot of the healthcare providers, especially we saw in our customers overnight, they reacted, they furloughed employees. They started to look at a world that was much smaller than what it was prior to March 2020. And lot of the workforce went out of the system during that time. And for a good 90 days, nobody knew what direction we're going to be going in, how the industry is going to play out. And it was a very tactical approach everyone was taking towards the COVID pandemic. And then as somewhat of that normalcy started to return through the middle of summer, with the surges happening and retreating in the various parts of the country, there had been a massive migration of people outside of the cities. People had moved around, and not much different than what we see in the hospitality industry, where people just got out of the industry for a variety of different reasons. They found different new jobs and more flexible work hours. Perhaps work from home became the norm for them. So a lot of those things started to play in there. And then as we sort of fast forward to come to present time and look beyond, what I really see is it's a brutal environment, not just in healthcare, but across the board. And I feel it's about to get a whole lot worse, given the CMS vaccine mandate coming. That applies to about 17 million people, regardless of the clinical responsibility or patient contact of these people. They are going to be in this, and healthcare providers are going to be competing with the holiday seasonal worker demand. Just to give some perspective, last year, Amazon by itself hired 500,000 people in 2020, and that trend has continued. And the approach Amazon has taken has been pretty innovative, giving flexible work hours, sort of absorbing folks into the gig economy. So you're seeing a lot of that happening. I was just reading UPS is about to hire 100,000 people in 1 month. So when you start to see all of those trends coming together, I think the staffing environment for healthcare is going to be extremely challenging, and it's going to require a fair bit of innovative thinking to navigate through over the next few months.
Jaideep, can you talk a little bit about where those staffing shortages are impacting the revenue cycle directly And kind of as a follow-up to that, do you think we've seen the complete impact yet, or do you think it's going to take some time before we really know exactly what this impact is?
Yeah, I think I can definitely speak to it from from some of our customers, right? The initial reaction, as I said just a little while ago, was to sort of pull back. But as soon as what they realized is the patient demand is there, they have to take care of the patients within their communities. And with all of that procedure volume comes the need for revenue cycle. And the initial sort of, okay, let's not worry about it mentality has gone away, and they're recognizing that if they don't deploy resources appropriately, there is going to be problems. They're not going to be able to recover cash, and it's going to severely impact their financial health of these providers. So what we're starting to see in the industry is a sort of move towards looking at the problem not just purely as a staffing problem or putting the burden on HR and recruiting that, hey, we got to go find more people. It's about understanding the business need or the business problem that we face. So for instance, it may be a business problem around accounts receivable. Do we have enough people in our revenue cycle department to follow up on claims? Well, you can have the people to do that. You can outsource that, but perhaps there is an approach there to look at a technology solution that marries with the staffing solution, right? So you're never going to eliminate the need for the people, but how can you make the people more productive so that they're focused on recovering the revenue dollars that you basically you don't want to see any revenue leakage around it. And so there is technology around bots. For instance, our revenue healthcare platform enables bots for our customers. We use managed services as well. So we bring in the specialists along with the technology. We do integration with the payer sites and clearinghouses to get the most current information. So that and we use AI and machine learning to really look at the accounts receivable and see where the cash opportunities are. So there is many ways to look at that, and I think that I just give that as an example, but a lot of the business processes within the revenue cycle spectrum can be looked at not just as a people problem, but as a overall business process that can be improved on. So this is in a way a great opportunity to sort of rethink those processes and see what's the best way to get back up and get the most productivity out of the same amount of staff that we may have.
How do you think, we've talked a little bit about how COVID's changed things, but can you talk a little bit about what the opportunity here is for, I mean, you touched on it a little bit, as now is a time to really reevaluate your processes and how you're doing things in terms of revenue cycle. Can you talk a little bit about how you would approach that?
Yeah, I think absolutely. That's exactly, I mean, what I mentioned a little earlier. It shouldn't be looked at as purely as a staffing challenge, right? It's a business challenge that sort of spreads across many business processes. And at the end of the day, if you're looking at sort of in revenue cycle management, you want to make sure you minimize your revenue leakage and you get maximum bang for buck. So in any case, you want the least amount of people touching a particular claim as it goes from start to finish, because that's where you make the most money in it. And our RCM systems and processes over the years, through the complex regulatory environment, through changing payer guidelines, continue to get complex, and sort of like the tax code, right? I mean, it gets more complex each year. And this today presents an opportunity for us to take a step back and say, what's core to my business as a healthcare provider, and what are best of breed solutions out there that I can deploy to make sure my revenue cycle operations are running smoothly and are scalable as my business grows. And that scalability means you've got to rely on outside partners and best of breed technology around it. What we're seeing in our industry, in our customer base today, is they're recognizing things like prior authorizations. It's difficult to be an expert across all geographies, all payers, all the time. And so relying on partners who can take them along the journey is extremely important to them. And they want to focus on maximum utilization and not get bogged down by administrative tasks. And these administrative tasks aren't going away. There is technology coming in to help assist that, but they're going to remain and more likely get more complex. So we see a tremendous amount of change coming from our customers in the industry around rethinking how prior authorizations are done, insurance eligibility and verification, and patient pay estimates. All of those are critical things that you can do prior to a claim going out. So you, again, reduce your revenue leakage. And the same thing we're seeing on the accounts receivable management and denials. Those are, if you have great analytics to tell you where really you need to focus on, perhaps you don't need as many people. And use AI and machine learning, again, to see how best you can work that AR inventory and chase the right dollar, chase the dollar that you feel that is going to return you cash, versus just going through a sort of drawn out process of touching every claim. So tremendous amount of opportunity. I think all of these things can serve as a catalyst to really reinvent the RCM operations of a lot of healthcare providers.
Right. Do you have any advice, suggestions for providers that are struggling to adopt new technology, hesitant to adopt? I think you brought up a lot of great points, so it would be helpful to just talk through how do you move that needle?
Yeah. And so what I like to recommend, and this is a message I tell internally as well as to a lot of our customers, is baby steps, right? If you try to solve everything, it's a heavy lift. Taking out an EMR, putting a new one in, or just saying I'm going to outsource my entire RCM operations, those could be potentially great initiatives, but if as an organization you've not been used to doing that, you may be setting yourself up for failure. So it's about going back to a particular business process and just saying, this is one that I want to solve. And yes, it won't solve all my problems, but it will put me on a path that I can then build on that success. And we've seen that deployed very effectively in a lot of our customers. And we tell them, is don't try to do too much first, right? If you've never done it in the past, let's start small. Very recently, we started with a customer where they were considering just outsourcing their entire RCM operations, and we said let's put the brakes on that for a second. Where really is your pain point? And it came around that their pain point was in the patient access side around insurance eligibility, verification, and prior authorizations. And we're like, hey, let's do prior authorizations. We can start to finish, help you with that. Let's get a working relationship going. The folks on your side, your staff, our staff, understand how it works, build on that success to then adopt. And that relationship has started to blossom because of that reason, is sort of picking that one challenge, be it saying, okay, I want to just do accounts receivable. I want to potentially reduce staff, deploy technology there to have a revenue uplift, or it could be prior authorization, or it could be insurance verification. Taking one task at a time, deploying, measuring the success, and really developing a blueprint for the next one from there on. That would be my recommendation and approach almost time and time again.
I think that also falls back to the measuring your KPIs. If you're seeing a huge amount of patient access related denials, then there's your place to start. Right.
Exactly. I mean, very often we find a lot of folks get into the weeds very, very quickly on these RCM tasks, and you've got to take a step back and say, if you're in the weeds, it's very difficult to really see the broader trends of what you're facing. So picking one or two and saying, this is my metric, this is what I want to improve over the next 3-6 month time frame, and developing an action plan around it, and then executing to it, right? And just deploy, measure, iterate. It works, and it delivers results.
Just to expand on that a little, we received a question: what are the best ways to retain and recruit qualified staff? We've talked about that a little. Do you have any other recommendations or suggestions for folks?
Yeah, I mean, what we do in our organization, right? We try to have and deploy the best practices, and we do that from learning from our customers and our partners and the industry in general. I think it's important, sort of demarcating between a job and a career, and we want to match up with folks who want to come and build a career with us. And for that, it means you have to show them a growth path, and you have to address their daily work challenges. Again, going back to some of the points we talked about, if obtaining an authorization is so convoluted, so complicated, perhaps it's something we have to break down into multiple steps, and multiple people have to pick up on that. And so and then you'll start to see the folks who want to move ahead from a career standpoint, and those are the ones you want to promote from within, give them the growth path around it. So having one-on-ones with the managers, having one-on-ones with their employees to really understand where are their challenges, what are their goals, and then aligning the organization to meet with the employees' goals. I mean, in today's climate, the employee is the most important stakeholder here. I'd argue just as, if not more than, the customer. And so it's critical we meet their needs, and we understand where they want to go, and they will help take our organizations to the place where we want to go.
Great, thank you. Let's take a look at the AR side. One of the questions or challenges that we got was not enough staff to work accounts. Can you take a deeper dive into how technology can, outside of your EMR, PM, can help with that?
Yeah. I mean, I think one of the things, again, we've built the technology around this and deployed at some of our customers with some amazing results, is really looking at the AR problem not from a volume perspective, but from a dollar perspective. And by that I mean, look at, there may be 1,000 claims, and they may be $100, $50, and all over the place. But what we've found to be extremely effective, is to deploy technology. We do AI and machine learning, where we look at 2 years of historical data, and based on that, we are able to predict which claim is going to get paid how quickly, and which one should the staff touch in order to move it along, versus going every morning and by a prescription cycle say, okay, I'm going to touch these claims over this dollar value or this payer. We feed that priority list to our staff, and we've seen upwards of 30% revenue uplift when really deployed well, because the technology, the computer can look at 30 to 40 different parameters and then make decisions, versus we may end up doing it in Excel spreadsheets, sort of very arbitrarily, either based on, oh, I only have 10 people working it today versus 20, and so I'm going to do this. Dynamically, technology can adapt to what your business environment is and really help you unlock the cash. And then beyond just using AI and machine learning, there's smaller things you can do, right? There's RPA bots that you can deploy. We do that from within our platform, where again, you can go check on status of claims very easily rather than picking up the phone, going to a portal. All of this stuff is coming together, and then it gets synced up within your EMR. So you have a very holistic view. And all of this on top of that, you have strong analytics that help you really drive your strategy, where you want to go with it, right? So when you're looking at your analytics, the KPIs, and seeing how you're doing relative to the industry benchmarks, that drives you to, again, develop the action plan that will help you get better.
You mentioned, we talked a lot about technology, but I also had a thought around, struggling to staff, folks wanting to work from home. Now is probably the time for providers to take a look at how they can support working from home. And scheduling is a great area that could be done that way.
Absolutely. And I think a year and a half ago, we were all forced to work from home, but there were some clear advantages to that. We as an organization had to overnight move a lot of folks who were working within our operation centers to a work from home environment, while keeping in mind that we're dealing with healthcare. So there's HIPAA concerns, and we have to be extremely careful when we're doing a lot of this stuff. But again, we took a deliberate action. We started to do it. And what we realized is in many cases, productivity shot up, because for one, there was nothing else for people to do but work. So that's changing now. But in general, what they saw was they were able to better manage their time. When they were working, they were super focused, and then they stepped away from it. So we saw tremendous amounts of benefit, and coming back now, there are key benefits to being in a work environment. I think training, knowledge transfer, and just overall social interactions are important in the workplace environment, but it doesn't mean it has to be 5 days a week, 8 hours a day. It can be a hybrid work environment. So we're testing out a variety of ways to do that. And it's been effective, and overall employee feedback has been very positive.
All right. And so every Thursday at 2 p.m. Pacific, 5 p.m. Eastern, we will hold office hours. If there are any topics that you would like to see us cover, don't hesitate to, again, reach out, let us know. And we look forward to seeing you again soon.
Yeah. Thank you. Thank you, Kate. And thank you for all attendees. It was a great conversation, and look forward to the next one.
Yeah, absolutely. Thanks, everyone.
Thank you.
Bye-bye.